Hello, and welcome to the National Foster Care Month webinar, Post-Reunification Supports and Prevention of Reentry. Into out of home care. This webinar is being recorded. If you object, you may disconnect at any time. Participants are muted throughout the webinar, but are encouraged to ask questions by typing in the QA pod on the right-hand side of the screen. Participants can also obtain today's PowerPoint presentation by clicking on the download button on the lower right Files pod. We are pleased to offer CEUs for this webinar. In order to qualify for CEUs, please ensure that you are logged in at the beginning of the webinar and log out at the end. If you have technical problems during the presentation, please feel free to type in the QA pod or contact rashana.roach@icfi.com. Following this presentation, you'll receive an email with the webinar evaluation and CEU links. At this time, I'd like to turn the presentation over to Taffy Compain of Children's Bureau. Please go ahead, ma'am.
Thank you. Good afternoon, everybody. My name is Taffy Compain, and I'm the National Foster Care Specialist at the Children's Bureau. May is National Foster Care Month, and it's a time to focus on enhancing the lives of children in foster care. This year's theme is honoring, uniting, and celebrating families, and centers on the reunification of families. As you'll note on this slide, the Children's Bureau, with the support of the Child Welfare Information Gateway and numerous partners representing stakeholders in child welfare, including those representing alumni of CARE, foster parents, and collaborating agencies, have developed a robust website with many resources relevant to foster care, and hope that you're able to visit us at www.childwelfare.gov/fostercaremonth. Today's exciting webinar is titled Post-Reunification Supports and Prevention of Reentry into Out-of-Home Care. This webinar, hosted by the Capacity Building Center for States in collaboration with the Children's Bureau, will offer a discussion on best practices for supporting healthy reunification and preventing reentry into foster care. In addition, this webinar will explore key social factors to consider during strategy development, some challenges and some lessons learned, and also the successes in promoting family unity and stability. On behalf of the Children's Bureau, thank you for joining us today, and I'll turn it over to Jennifer Marcelli from the Center for States.
Thank you so much, Taffy. Hello, everybody. My name is Jennifer Marcelli. I'm a Program Area Manager with the Capacity Building Center for State. And before we get started on today's presentation, I'm going to quickly go over the agenda for the day. As we just heard from Taffy from the Children's Bureau, in a moment I will introduce you to our panel of presenters. And then we'll hear about the Post-Reunification program. We'll hear from a parent on her story and how this program has impacted her. And then we will hear from the Duke Endowment and Child Trends. And then we've saved some time at the end for folks to propose some questions, and we'll have presenters be available to answer those. So as I said, I'm Jennifer Marcelli, Program Area Manager for the Center for States. You just heard from Taffy Compain, the National Foster Care Specialist from the Children's Bureau. And then in a moment, you'll hear from Chrissy Triplett, the Child Welfare Program Manager of Catawba County Social Services, Heather Ball, the CQI Manager from Catawba County Social Services, and then we'll hear from Portia, who is a parent and a reunified mother. And then we'll finish off with Phil Redmond, Jr., the Associate Director of the Child Care Division of the Duke Endowment, and Karin Malm, the Senior Program Area Director of Child Trends. Before we get started, I just wanted to go through the purpose of today's webinar. Will be to discuss specific strategies to address post-reunification support and prevention of reentry. We're also going to provide the specific example on a state post-reunification program. As Taffy mentioned, their challenges, lessons learned, and how their program has positively impacted families. The objectives for today's webinar is to increase knowledge and understanding of reunification, the benefits of supporting post-reunification and preventing reentry, understand the specific strategies that support post-reunification and prevent reentry, hear from a state on an example, evaluate the effectiveness of post-reunification supports, as well as, next slide, please. Okay, and then now I'm going to hand it over to Chrissy. Chrissy?
Hi, so we're going to begin today just talking about what is reunification. And reunification occurs when a child is reunified with a parent or primary caretaker from foster care and legal custody is returned to that parent or primary caretaker. Please, next slide. So we have a polling question. So if you guys will take a minute and answer on your screen, what percentage of children who enter foster care are reunified with their caregivers? So it looks like a majority of you say 60%. So according to the 2013 AFGARS report, 51% of children are reunified with their parents and caretakers. So next slide. There are several benefits of reunification. Children do best when they're raised in a stable family setting. Therefore, we must support families to increase their protective factors and provide a stable family setting. There are also cost benefits in reducing the number of children and youth in foster care. When children can safely be returned home, the cost of having children in foster care decreases, ultimately saving money. States can avoid funding sanctions by meeting federal outcome goals. It's the Child and Family Service Review, the CFSR's goal, to achieve permanency in a timely manner. If this does not occur, states risk the withholding of Title 4B and 4E funds. The timely permanency measure in the CFSR includes the benchmark reunification measure. Next slide. So we have another polling question. What do you think is the percentage of children who re-enter foster care? Please choose the percentage you think is closest. Looks like there's a mixture of numbers. So AFGAR states that 13 to 15% of children re-enter foster care. Next slide. It is important we prevent children from re-entering foster care. Re-entering foster care can be detrimental to a child's well-being and cause an outer layer trauma. The greatest social environmental risk factor to reunification failure is poverty and economic hardship, especially housing instability. There are some child characteristics of children who re-enter foster care. Some of these are children with chronic medical illness, mental health diagnosis, children who are of infant age, of African American race, and of preteen teenager age. Current child welfare policies place a priority on reuniting children with their birth families as a way of achieving permanency, but a significant minority of those children re-enter foster care. Outcomes for youth who spend a relatively short time in foster care before returning to their families are not well documented, and little is known about post-reunification services that could stem this re-entry into foster care. I'm going to turn it over to Heather Ball to tell us more about the Child Wellbeing Project.
All right, thanks, Chrissy. Next slide. So Catawba County Social Services, along with the Duke Endowment, decided to find a way to support families after they exit foster care. But before we take a closer look at the project, I want to tell you a little bit about Catawba County. Catawba County has a population of approximately 154,000 people. It's a rural county, about an hour northwest of Charlotte, North Carolina, in the foothills of the Blue Ridge Mountains. Despite being rural, Catawba is considered a large county in North Carolina's county-administered child welfare system. Catawba County offers a full continuum of services to citizens and has approximately 430 staff. The Child Welfare Division provides mandated child welfare services, which include child protection, foster care, and adoption services. Currently, we have 230 children in foster care. In addition to these mandated services, we provide an array of mental health and prevention services as well. Next slide. The Duke Endowment began a partnership with Catawba County in 2006 on a project to look at the long-term well-being of children who experience foster care. Catawba County was selected due to the agency's history of innovation and its ability to implement a full continuum of services. After consultation with experts in the field, post-care became the focus of the project due to lack of availability of post-care service models for all permanency types. To learn more about what families needed and what gaps existed in services, Child Trends completed a needs assessment with post-care families in Catawba County. We learned from that assessment that reunified families had difficulty fulfilling all their responsibilities to courts and to DSS, while at the same time meeting the needs of their children and dealing with everyday life. Parents also discussed the lack of adequate child support, the lack of transportation, and being ineligible for certain services like Medicaid and food assistance. They stated that the following would be helpful to them: material support, such as being able to maintain their Medicaid and food assistance, and referrals to other agencies that provided material assistance, assistance with daycare and child care, therapy for children, adults, and the family together, parenting classes, and drug and alcohol support groups. Next slide. Additionally, reunified parents reported that they wanted someone who would be on their side, a person who was not a social worker, someone who was available to help, and someone who could check on them. They also mentioned that concrete supports would be very helpful in times of need. In response to the needs assessment, review of literature, and exploration of evidence-based programs to meet the needs of families post-care, it became evident that Catawba County needed to develop post-care services to meet these identified needs. So an array of services was developed based on needs identified by adoptive parents, reunified parents, guardians, and child welfare staff through focus groups and literature review. In addition to the Success Coach service, other services originally were part of the Child Wellbeing Project. These included parent-child interaction therapy, educational advocate services, strengthening families parenting program, adoption support groups, and material support. Since 2012, the Child Wellbeing Project service array includes Success Coach services, material support, and educational advocate services. Several project partners made the development of the Success Coach service and evaluation possible. The National Implementation Research Network, NIRN, based in UNC's Chapel Hill's Frank Porter Graham Child Development Institute, became involved with the project in November 2007 to assist with project development and implementation of the service array. Independent Living Resources Incorporated completed a process evaluation of the Success Coach service from 2009 to 2014. In 2015, Child Trends was chosen as the project evaluator to complete an outcome evaluation of the Success Coach service. These organizations, along with the Duke Endowment and Casey Family Programs as funders, and Catawba County Social Services as a project site, serve as project partners. Now we have another polling question for you. Next slide, please. Do you believe families that have reunified will want services once they exit foster care? All right, it looks like a lot of you are saying yes. And what we found since August 2010, since we started serving families with the Success Coach service, about 52% actually decided to take the service. The Success Coach service is a voluntary service provided to families when they exit foster care. Reunified families, adoptive families, and guardianship families are all eligible for this service. I think we're on the next. Okay, great. The primary goals of the Success Coach service are to support the family in providing a stable, safe environment for their children and youth to build individual and family resiliency and to implement supports that will have positive long-term impact on the post-permanency stability and child well-being. This is to be done through reducing risk factors and increasing protective factors, specifically reducing the risk of repeat maltreatment, reducing the risk of reentry into foster care, increasing social supports for the family, increasing self-sufficiency, and the family's ability to manage crises, increasing the parent's ability to access medical and mental health services for the child, as well as their parenting skills, and increase the child's ability to perform on or above grade level in school, and the parent's ability to advocate for educational services. The Success Coach program includes material support to provide financial support in times of crisis and to improve child well-being. The Success Coach's mission statement is, Success Coaches, through support, education, and coordination of services, work with families to strengthen permanent placement and enhance child well-being for children who exit foster care. Next slide. The underlying theory of change is informed by the risk and resiliency theory. In the case of the Success Coach service, risk factors are those factors which would increase the probability of a child's re-entry into foster care. And protective factors are those factors which would promote the child and family well-being, reducing the probability of re-entry into foster care. The interplay between risk and protective factors at each level in the ecological model, the individual, family, and community levels, influences an individual or family's resilience. And this is depicted in the graphic above. As you can see, all these factors together can work together to increase those protective factors and reduce the risk factors, which in response impacts the resiliency. Now I'm going to hand it back over to Chrissy.
So there are several philosophical principles that undergird the Success Coach's work with family-centered, which are family-centered, strengths-based, well-being-focused, empowerment-driven, culturally sensitive, trauma-informed, team-oriented, and ethical. These principles guide how Success Coaches implement the following essential functions into practice. So the first one, engagement. Engagement is the ongoing ability for Success Coaches to establish and sustain a genuinely supportive partnership with families while establishing and maintaining healthy boundaries and assessing the most effective manner and time to communicate with the family and maintaining contacts as mutually negotiated. So as you can imagine, engagement is one of the most critical functions of our service because if we're not able to engage the family, we're not able to do the next pieces. So we are a voluntary program, so we often try to make sure that it's important for the families to understand the difference between our program and mandated services. So you'll see Success Coaches going into the homes and doing hands-on activities with the children and families so they can see how it's different from mandated services. They often will play games with the children, such as Jenga, where they're able to engage in a fun way to learn more about the family dynamics. We also have $25 per family that we use, and it has engagement funds so that they can do things like buy them pizza. So if they're coming to the home at a dinner time, they're able to complete interventions while also not taking the burden of the family off their trying to prepare a meal. The other function of Success Coach, another function is assessment. We use several assessments throughout the Success Coach process. One assessment that we use is the North Carolina Family Assessment Scales, General Services plus Reunification, which is also called the NCFAS-G+R. And this is an overall family assessment scale where it uses 11 domains that relate to aspects of family functioning. That is the major family assessment goal that we use. Other assessments that we use are going to assess the social and emotional health of children, and we use the DECA and the DECA-IT and the DESA. And these are all different standardized assessment tools to measure social and emotional health. The DECA stands for the Devereux Early Childhood Assessment. The DECA-IT is the Devereux Early Childhood Assessment for Infants and Toddlers. And the DESA stands for Devereux Student Strengths Assessment. We're going to use those on children that are birth, and it goes up to 8th grade. For our older children who are in high school, we look at assessing their independent life skills. So we use the Casey Life Skills Assessment. We also do a trauma assessment with all children who have entered foster care who are not in trauma already in a trauma-informed treatment. We're going to assess their level of trauma and ensure that they don't need referrals outside for trauma-informed treatment. Another essential function of the Success Coach service is goal planning. And this is where the Success Coach works in partnership with the family, including the children and youth if age appropriate, to develop a success plan based on the strengths and needs identified in the assessment process. Another function is service coordination, and this is another word for the case management. This is where Success Coaches provide supports and services, share information, and link families to resources. Skill building and reinforcement is when success coaches build resiliency and protective factors in families through targeted activities that build new skills and reinforce skills learned. We also provide crisis intervention, prevention, and management. Success coaches help families in crisis set priorities, effectively weather the crisis through support, education, skill building, and referrals. The success coaches are on call 24/7 to their families. They also provide advocacy, and this is where success coaches provide support and encouragement to families as they build the confidence and capacity to identify, address, and meet their own needs. We often see success coaches supporting families when they're in the educational setting and doing different teachers' meetings. They're helping those parents have the confidence to address these educational needs. There are several implementation drivers. In our next slide, please. In our partnership with NERN, we learned about implementation science and the drivers into implementation, which drives all the work we do in Success Coach service. In preparation for implementation, Catawba County focused on using best practices, assuring that the core implementation components or implementation drivers needed to support practice, organizational and system changes were in place. These core components include, as part of competency drivers, staff selection, training, coaching, and performance assessment. At the organizational drivers, it includes data-driven decision systems, which is using data to inform decision-making, and facilitative administrative management, which is support from upper-level management, systems interventions, which is systems organized to support the work, and then we also have leadership drivers, which are technical and adaptive. Next slide, please. So they're incompetency drivers. These drivers directly relate to staff and social work proficiency in carrying out the essential functions of their service delivery. So we're going to start with selection. This driver refers to hiring of staff for various positions across the service delivery continuum. Staff should meet all required academic requirements and years of experience, but beyond academic qualifications or experience factors, certain practitioner skills are difficult to teach in training sessions, so must be part of the selection criteria. Some examples of this are knowledge of the field, common sense, social justice, ethics, their willingness to learn, their willingness to intervene, and having good judgment. It's critical to have fine-tuned interview guides to facilitate effective selection. Questions should be specifically tailored to the skills, abilities, and qualifications to perform well in the position. So then training. This driver refers to imparting knowledge, skills, and abilities in how to deliver the service. Training should be standardized across all staff and delivered consistently to all staff and across repeated trainings. Coaching. Most skills needed by successful practitioners can be introduced in training, but really are learned on the job with the help of a coach. Coaches not only expand the knowledge and skills taught in training, they also impart practice wisdom. It's critical to the competency of staff to have a coach to reinforce existing skills, abilities, and newly learned skills as part of the training package. Next slide. So, organizational drivers relate to how structured and systems within the organization support service delivery fidelity. Decision support data systems are sources of information used to help make good decisions internal to an organization. Effective organizations make use of a variety of measures to assess key aspects of the overall performance of the organization, provide data to support decision-making, and assure continuing implementation of the evidence-based intervention and benefits consumers over time. Facilitative administrative support is proactive, vigorous, and enthusiastic attention by the administration to reduce implementation barriers and create an administratively hospitable environment for practitioners. In an organization that hosts an evidence-based program or practice, facilitative administration includes internal policy analysis and decisions, procedural changes, funding allocations, and a culture that is focused on what it takes to implement with fidelity and good outcomes. Systems intervention requires attending to a multi-level alignment, maintaining leadership and focus, creating and staying connected to champions, intervening to change policy and funding contingencies, and remaining vigilant at local, state, and federal levels for both windows of opportunity and threats to fidelity and sustainability are all arenas for systems intervention. Leadership and responsibility for this systems alignment function must be clearly articulated at each level and with an overall structure to support the communication within and among these levels. Next slide. Technical leadership, like the hierarchy seen in the picture on the left, might be thought of as good management. A leader is engaged, quick to respond, and recognize to issues that arise, organize groups to solve problems, and regularly produces desired results, solving challenges that you know how to solve and have the tools to solve. Adaptive leadership, like the circular process depicted on the right, is required in the zone of complexity where there is little agreement and less certainty. The concept of adaptive leadership resonates with leaders who recognize the layers of complexity involved in any large-scale system reform, solving challenges using knowledge and experience, but the solution is new. Next slide. We have another polling question. How many of you use behavioral rehearsal role plays in your interviewing process? So we got about 30% of you do and about 70% don't. So it is important to get the right people in the position to do the work that we do. Next slide, please. We designed our interview guide to align with our philosophical principles and essential functions. And we're going to tell you more about our role plays. But we also wanted to assess individuals' ability to self-reflect during our interview process, because self-reflection is a critical skill when working with children and families to know how to adjust your practice and acknowledge your strengths and areas to grow. Lastly, we accept how candidates integrate feedback, and this is done through our behavioral rehearsal or role play. So during our interview, we're going to have a role play, and we're going to give them a script. The candidate's going to have a script, and they're going to role play with the interview panel. We're going to pause the role play at a point during the role play, and we're going to provide feedback and ask them to incorporate a new technique. Lastly, we're going to ask them to reflect on the role play, which again allows us to see their ability to self-reflect. So as you can see, this is a key point of our staff selection, is using a behavioral rehearsal. Next slide, please. So we have another polling question. So how many of you guys began in the field of social work with an initial training, a manual, and a caseload in the first couple of weeks on the job? Well, I am glad that I am not alone, because that was my initiation into child welfare. And this is my 15th year into child welfare, and I can remember those first days very fondly. I went through pre-service training, and on my first day back, I had a stack of cases on my chair. And later that evening, I went and picked up a kid on my caseload from jail. So often, because of the nature of work we do, coaching is thought of as a luxury, when in reality, coaching should be standard. Coaching is how we create and keep strong social workers and how we will work to provide the most effective services possible. Coaching of the Success Coach is an integral part of the Success Coach service, so that new skills learned in training are used fully and effectively with families, and workers grow in their competency to provide the service with skill. Coaching fosters the Success Coach's ability to integrate the philosophical principles and essential functions into the delivery of the Success Coach service. This is done through individual coaching sessions, team coaching, case files reviews, and field observations. Unlike supervision, which focuses on the compliance of tasks, coaching assists the Success Coach to become more competent in the service delivery of the skillful delivery of the service. So based on research by Joyce and Showers, we learned that with classroom instruction alone, participants gain 10% of the knowledge taught and will transfer 0% into practice. If participants experience classroom instruction, demonstration, practice, and peer coaching, they will gain 95% of the knowledge taught and 95% into practice. So as you can see, this is why we strongly believe in coaching. In individual coaching sessions, the coach reviews cases with the Success Coach and assists the Success Coach to identify his or her own strengths and areas of growth during interactions with families. The coach reviews with the Success Coach whether the principles and functions of the service are being implemented as intended. The coach provides conceptual feedback, which is a way to give feedback focusing on concepts first rather than a blow-by-blow account of what occurred. And this feedback relates to the essential functions and illustrates the feedback with examples from various data sources, such as observations or case reviews. The coach is regularly assessed with the Success Coach his or her training needs and areas in which he or she would like to grow. The coach will engage in situational or scenario role plays to enhance staff confidence and the ability to deal with various family issues in the field. Field observations involve the coach accompanying the success coach on a home visit and observing the interactions with families. The field observation allows for the coach to provide conceptual feedback related to the essential functions observed on the home visits, including strengths and areas to grow. The success coach provides written and verbal feedback about the interaction using the principles and functions of the service to guide the feedback. How do we make sure implementation drivers are still in place? We have a program review. The program review is a process that allows a critical look at the success coach service on a regular basis. A program review meeting occurs monthly and includes the success coaches, supervisors, a program manager. Along quarterly, we include stakeholders. This meeting addresses the systems issues, strengths, and barriers of implementing the success coach service. At each review, data about the service is assessed and adjustments are made on the service based on the data. If an issue arises, needs to be brought up to administration, a program manager is present and can address those issues with upper management in the agency. So Heather and I are going to review some lessons we've learned along the way. So along the way, we learned a lot of valuable lessons in implementing a new service, and we wanted to share them with you. So implementing a voluntary service alongside mandated child welfare services can be challenging. There can be resentment amongst the mandated workers that voluntary workers have the easy jobs. And this can make it a challenge for staff to feel accepted and valued in the workplace.
It takes 2 to 4 years to fully implement a new service. And I know that sounds like a lot, but implementing without preparation is not going to be successful for you or for the families and children you serve. Do not underestimate your organization's readiness for a new service. We spent 3 years preparing, developing, creating, and implementing this service into a child welfare system, and it still can be challenging.
The material supports. When providing concrete supports in a time of crisis, make sure you understand how the family will not be in the same crisis next week. So, for instance, if they have an eviction notice and you help pay the rent, how are they going to pay the rent next month? It may be more beneficial to help the family move into an affordable living arrangement versus helping them to get out of an eviction notice.
Lastly, data collection. It's important to collect as much data as possible early on. This way, as you continue to figure out what works with the service, you have the data necessary to do that, and you don't have to go back and collect data that you might have missed along the way.
So I'm going to introduce Portia, who's a family who's worked with our program and was reunified with her daughter, and she's going to tell us more about her story. And we're excited to have her join us here today as she took off work to join us in and is fighting off a cold. So we're glad she's here with us.
Thank you. I was involved in substance abuse, crack cocaine, and I lost custody of my daughter in 2007. She was 3 years old. I was devastated, and I attempted to run with her, and I knew that they were going to take custody of my child when I saw a DSS worker and an officer pull up at my house. We proceeded on to hide in the house until they left, and then I took her and went to a friend's house, and the social worker called me and told me if I didn't bring my daughter to her that she was going to get an Amber Alert out on my daughter. So I spent the night with my daughter that night, focused on her, and I took her to my sister-in-law's house, and at that time my sister-in-law had talked to the social worker. The social worker shows up with another social worker, which I guess was a supervisor and an officer, and I had explained to my 3-year-old what was going on and that she would have to go with them for a little bit, but Mommy would get her back, and it was the hardest thing I've had to do, but I did. And, you know, when they came and they picked my daughter up from my sister-in-law's house at that time, I just wanted to get numb. I did not want to get sober. I wasn't trying to get sober because I had lost my world. And so I still kept using, and honestly had used for about 2 weeks straight and was still going to court every court date. And I sat beside my dad during the court date and had no idea that I had been sitting beside of him for the whole day until 2 o'clock after lunch, after break and everything, before my case got heard. He makes a very distinct noise when he clears his throat, and when I heard that, I felt about 2 inches big. So when I got up before the judge with my attorney, I had asked my attorney if I could move to Tennessee with my dad. And my dad, he had no idea that I was going to do that. And so when he got up there and Judge Edwards asked him if he had any objections to it, he said, no, I live so far in the country, there's no way she'll be able to get any kind of drugs or use it all, and if she does, I'll make sure she gets her butt tore up. So I moved to Tennessee with my dad, and there I completed parenting assessment classes. I kept coming down. We came down at least 2 to 3 times a month. We drove 3 hours away just to see my daughter for an hour. We did Christmas with my daughter in foster care. We did her birthday, which was in January. And I worked my case plan and was reunified with her within 5 months. And at that time, the social worker I had said they've never seen a kid come out of foster care in 5 months. After we were reunified, I still continued my parenting classes and the substance abuse classes. When I moved away, it was the best thing that I did. I moved back because my mom's illnesses and her being sick. And I realized that I had to change my people, places, and things, my surroundings. I still continue to go to classes every week. I still, am very active in meetings and, work, church, and things like that. Honestly, I have had relapses. I've did a lot of work with Cognitive Connection. I did the parenting classes, behavioral intervention, peer support, regular and intensive outpatient treatment. And I had back surgery in 2011, and so I started taking pain medication. I ended up replacing my cocaine habit for the pill addiction due to taking pain medication for my back. And so needless to say, now I'm on Subutex, which is a form of Suboxone, and I go to groups every week to maintain my sobriety. And I had like 7 CPS reports in less than 3 months. And the last social worker that I had actually introduced me to Lisa. Well, she gave me Lisa's number, my success coach, which is Lisa Thompson. And at that point, I'm not going to lie to you, I did try to dodge her and avoid her, even though I knew she was voluntarily, and I didn't have to see her. And then finally I sucked it up and I met her, and I feel like in the last 3 to 4 years we've become really good friends. And, she's helped me with anger management problems that I used to have when we first met. She's helped me with so much with my daughter, and now I have a 2-year-old and a 5-month-old, and actually another one on the way. I do the RAM meetings and the support groups for other reunified parents. And when I'm at my support groups, anybody that I know that has lost their kids and they've got them back and they're fighting for their kids to come back, I automatically, tell them about the Success Coach program. And I've had so many people call Christy and Lisa to talk to them about the program just because they, if I feel like someone is trying their best to get their kid back, but yet DSS and CPS is against them, I'm going to try to help them any way I can. And, when I moved back to North Carolina, to Catawba County, I actually ran into one of my old crack dealers, and I was working in O'Charlie's at the time. He came in, and I told him, I was like, he asked me if I wanted a crack rock, and I said, no, just grab a menu and sit down or leave. I said, I'm clean and sober, and I'm staying sober. And, other than the Suboxone, I've been sober off crack for 7 years or better now. And, like I said, I'm still involved in Center Street Psych, and I attend substance abuse classes there weekly. Just to maintain my sobriety and to stay regular with everything and to stay active with my kids and to feel normal. I have a positive support system. I call my success coach as needed. I call her a law, honestly. I also continue to utilize the skills that I have learned, my participation, and my skills that I've learned post-care service, and am able to keep custody of my children and my other younger two, as well as never going into foster care again or any more CPS reports are called. I'm very proud of this. And now I'm going to hand it back off to Heather.
Thank you, Portia, for sharing your story with us. That was really great. You've come so far, and we want to congratulate you on that. Now we're going to hand our talk over to Phil Redmond with the Duke Endowment, and he's going to talk a little bit about the endowment's involvement in this project.
Thank you, Heather, and welcome to all the participants as well. The Duke Endowment, we're a private foundation headquartered in Charlotte, North Carolina. We are a regional funder, which means we fund only in North and South Carolina. We have 4 program areas: higher education, which is limited to 4 specific schools. We fund in health care, which is primarily through nonprofit hospitals, free clinics, area health education centers, academic institutions. We have a rural church program area that funds rural United Methodist churches in North Carolina, which is fairly unique for foundations. And then finally, the area in which I'm a program officer is an area we call child care. Next slide, please. In child care, we have 2 areas of focus. The first is prevention and early intervention, which is primarily a great deal of emphasis on evidence-based programs and supporting those programs. The other area, which is more pertinent for today's discussion, is our out-of-home care work, which focuses on the child welfare system and child welfare participants in the population. We invested in this project back in 2006 because of our belief that the system focused almost exclusively on safety and permanency and paid really just lip service to well-being. We believed and still believe that when children exit foster care, either through reunification, adoption, guardianship, whatever means, that services are they continue to need to be offered to families who they aren't suddenly without need of services simply because they've exited the foster care system. In our minds, permanency wasn't and isn't an end to itself, but is really more of a stepping stone towards well-being. We think that the outcomes that many former foster care youth experience and are experiencing supports this hypothesis. Also, we invested specifically in Catawba County because of their leadership, their vision, as well as their past experiences with transformative work. Next slide, please. We hoped with this project to see improved child well-being. These are ultimately the outcomes we want to try to measure. So as a result of this work, we want to see children who are making wise life choices. They're avoiding risky behaviors. They're educated. They're employable. They're connected to their families, to their communities, spiritually, and so forth. Also, we wanted to use evidence where it existed and implement that evidence with quality and appropriately. And where evidence didn't exist for something, we were willing to pay for its development. We really wanted to test our hypothesis that when reunified and adopted children are offered and their families are offered services and those services are utilized, that we will begin to see improved child well-being outcomes, which we believe ultimately should be the primary focus of the child welfare system. Next slide, please. We recognize that we are a bit unique. We're somewhat of a local funder, and we're interested in child welfare. The vernacular in today's world talks about evidence-based programs and collective impact and performance-based contracting and results-based grant-making. And funders, like the agencies they fund, want to participate in those conversations. They want to believe that the grants they're making are evidence-based, that they are having a result, that they are really rewarding quality performance. So we think that when used as the hooks, that they will enable those kinds of projects and these kinds of phrases will at least encourage a conversation between others who are interested in this work and funders who might be willing to entertain it. We have recognized, though, that in many respects, projects like this boil down to leadership, and that's leadership from the most senior leader all the way to the supervisor of frontline staff. They have to be engaged in this work, and it requires that everyone in the agency, from frontline staff to senior leaders, understand what implementation is and what it's not. And by that I mean recognize that implementation is not simply selecting an evidence-based program, doing a lot of training, and then asking folks to go forth and do well. That, as Heather and Chrissy and Portia have described, it's a lot more work. But at the end of the day, we think that work is paid off by the creation of a service we strongly believe in, which is a success coach. One thing that we try to do when on calls like this is to offer to talk to your funders about this work, about why we funded it, and our experiences with it. So feel free, you've got my contact information, or you will have it at the end of the webinar, to email me, and I'm happy to talk to any funder that you may be into conversations with yourself about this work. But at this point, I'm going to stop talking and turn it over to Karin from Child Trends, who's going to talk a little bit about the research.
Thank you, Phil. And in order to build the evidence that Phil mentions, it takes evaluation. And as Portia mentioned in her talk, there's other services out there, services that are worthwhile and families take advantage of. So we want to be sure that the Success Coach model that Catawba County has now spent several years building and perfecting actually works. So I'm going to give you a brief overview of the evaluation. And as Heather mentioned, the Success Coach program had been previously evaluated as embedded in a larger evaluation of the Child Wellbeing Project in Catawba County. The evaluators of that study found through analysis of both qualitative data gathered through interviews and focus groups and quantitative data in the form of administrative data and Success Coach program specific data, that the presence of a Success Coach in the lives of post-adoptive and post-reunification families appeared to function as a stabilizing influence, decreasing the risk of reallegations of abuse and neglect and reentries into out-of-home care. Issues of low program enrollment and the co-occurrence of other programs, I think Chrissy or Heather mentioned the parent-child interaction therapy and the Strengthening Families parenting program that were offered alongside the Success Coach services, complicated the ability to determine whether there was a direct association between the Success Coach services and the positive outcomes that the families realized. So Catawba County and the Duke Endowment were interested in taking that next step. They wanted to conduct a rigorous outcome evaluation of the Success Coach program with reunified families. So many discussions between Catawba and Child Trends took place to discuss various different evaluation designs. And during those discussions, we discovered that Catawba had plans to expand the delivery of their post-adoption services into 7 new counties. This meant that the Success Coach managers would be forging new relationships with the Department of Social Service managers in those other counties. And Catawba had raised the possibility that they could expand their Success Coach services into the new counties to serve families being reunified with their children. And for Child Trends, this provided a new population of families that would be eligible for Success Coach services, and it also opened up evaluation design possibilities. So after discussions with Catawba, Child Trends submitted a proposal to the Duke Endowment and is now conducting a rigorous impact study and comprehensive implementation study across the 5 counties. We've designed the evaluation to examine both the impact of the Success Coach services on children and families. We're also assessing the continued functioning of the program after several years of implementation, and we're learning the extent to which Success Coach services can be replicated and adapted in new counties. Next slide, please. So we've designed the evaluation to examine the following outcomes. First, we're examining whether children and families assigned to the treatment group are less likely to experience a reoccurrence of abuse or neglect than children and families who are assigned to the control group. We're also examining whether children in the treatment group are less likely to reenter custody. And as Phil mentioned, we're also looking at well-being, determining whether children in the treatment group experience better well-being outcomes than children in the control group. And then we'll also examine their outcomes and whether or not they differ depending on a variety of case characteristics, such as the length of time the child had been in care prior to being reunified, the type of placement they were in. And again, the implementation piece to our evaluation will look at the differences in how the program is being implemented across the counties. Next slide. A little bit more about the evaluation methods. In each of the 5 participating counties, the county program managers provide monthly updates, basically lists of children who are nearing reunification, and they provide those lists to Success Coach staff. These soon-to-be reunified families are then randomly assigned by Child Trends to 2 groups, treatment and control, and the consent procedures are administered by the Success Coach worker during a joint visit to the family's home with the county DSS worker before the case is closed. So they have to consent to being part of the study, and then the families who are assigned to the treatment group are offered the Success Coach services, and the families assigned to the other group are not offered the services. A number of data sources that we're using. The Success Coach program data that is compiled by Heather. This information, of course, is only available for those families who actually receive the services. We also are collecting child and family well-being information at that baseline, which is that joint visit where the Success Coach visits the family in partnership with the county caseworker. So we collect that information at baseline and then every 6 months for a minimum of 2 years following the reunification. Also at that time of the joint visit, the county caseworker, since they have the most information about the family at that point in time, completes an assessment of the family functioning. It's actually a mini child and adolescent needs and strengths tool that is being used. And then the parent also self-reports on child and family well-being measures, neighborhood supports, service access and utilization, as well as the parent's adverse childhood experiences. So we've combined a number of different measures into a tool that's administered during that baseline visit. And then ultimately we'll be collecting administrative data to examine the reallocations of abuse and neglect and the reentries of children into custody. For the implementation study, we will be conducting interviews and focus groups with key stakeholders during annual site visits to each of the 5 participating counties. And then the stakeholders include a variety of both agency folk as well as Success Coach program staff. We're hoping to speak with judicial personnel, guardians ad litem, and then community providers of services that families might be receiving. We started enrolling families into the study in October, and to date, 13 families are enrolled. Next slide, please. While we initially projected a study period of between 3 to 5 years, this of course depends on the numbers of families that we enroll in the study. And those numbers are dependent on the number of reunifications that are happening across the participating counties. Next slide. So as with any research study, we face challenges. As I mentioned, we made initial projections on sample size based on past years' numbers of children reunified in the participating counties, and we knew this was likely to fluctuate over time. One of the ways we've tried to address the challenge of sample size is to ensure that each of the counties is actually referring all eligible families, that is all families in which a child is being returned home. So in the early stages of the evaluation, we developed what we called a terms of reference document, which identifies the roles and responsibilities for each of the partnering organizations, that is, each of the county Department of Social Service agencies, the Success Coach program staff at Catawba County, and then Child Trends. And as we noticed referrals dip over the past few months, we're revisiting those terms of reference with each county so that we ensure that all eligible families are referred to the study. And we're also considering whether to recruit another neighboring county or possibly 2 counties to participate in order to increase our sample. And with that, I will turn it back to Jennifer.
Thank you so much, Karin, and Phil, and Chrissy, and Heather, and especially Portia. And Portia, I just wanted to let you know before we get into questions, we did have some, folks respond, and thank you for your sharing of your story, and congratulations on your success and your desire to help other parents. I just wanted to make sure to pass that along to you. I want to remind everybody, if you have some questions, you can use the Q&A chat feature, and we're gathering all of those questions, and we'll start asking them. So please feel free to ask some additional questions if you have them. So I'm going to go ahead and get started. Chrissy and Heather, there's a question. Does your county have reunification celebrations for your families once they reunify? And if so, which agency takes the lead in planning the celebrations?
All right. So we do have a reunification celebration. We do it actually, we provide the family usually like a certificate at the end of their reunification when they leave court. But we also, in the month of June for Reunification Month, we have a big celebration with all of our families. And we have a parent advisory committee that meets monthly, and we let them choose what they'd like to do. So this year they picked a place where they can go with their kids and play, and it will have food. I mean, places that they don't always get to go to because it may cost a little bit more money than anybody wants to spend. So we usually do that for events, and we give them a certificate and a picture of their family to celebrate their reunification every year. We are the people who usually take the lead. The parents give us their ideas, and then the Success Coach team takes the lead in planning this celebration. In our agency, the Success Coach is a division under our Child Welfare Division as part of our social services. So it would be that agency leading it.
Thanks so much, Chrissy. The next question is, does North Carolina require any post-placement supervision upon reunification, or does the case close at reunification? And more specifically, is the exit from foster care when reunification happens or when the case is closed?
The exit from foster care is when reunification happens and custody is transferred back to the caregiver who the child is being reunified with. And after that, the social services agency is not required to continue to follow that family.
Great. Thank you, Heather. The next question is the role play done in the first interview or in follow-up interviews?
Typically, we do 2 interviews, and the role play is done in the second interview.
Okay. And then the next question is around the competency drivers and the selection of staff. Are all of the coaches child welfare professionals, or only, or can informed, trained foster care advocates become participants? And we did try to ask for some clarification around what foster care advocates are, so I don't know if you can answer that question, but maybe you can talk a little bit about, are they all staff, or who all can be a success coach?
Yeah. Well, and the minimum required for a success coach is that they have a bachelor's degree and at least 2 years of experience working in the child welfare arena, or with families who have experienced abuse, neglect, or dependency. It may not be directly in a child welfare agency. They may have another unique kind of experience. And because our unit is tied into child welfare, they are employed by a child welfare division, by the Division of Social Services.
Great, thank you. And Karin, this may be a question for you. Can the family be a part of the study even if reunification was against the agency recommendation?
Thank you. You mean the court-ordered reunification against the agency recommendation?
Yes.
I believe that would be a Chrissy or Heather.
Yes. Yes, the family would still be eligible because the foster care exit type, how the permanency type would be reunification, even if our agency was not recommending reunification. If that's what the court ordered and the child returned to that caregiver, then they would be eligible for the study.
Great, thank you. And the next question is, how long is the Success Coach service?
The Success Coach service, on average, families are involved with us for 2 years, and we try to we close the service out within 2 years unless there's another significant or developmental milestone, and we have goals working towards that. But the average is 2 years.
Great, thank you. And then another question was around where you find your Success Coaches, a little bit more about the, I guess, recruitment of those folks.
Yeah, we have a human resource department that lists any vacant positions that are with the Catawba County, but they use several different resources across North Carolina to post jobs. I know they tie into different school systems to advertise for jobs, but our human resource department does all of that. We usually see applications of Success Coaches from all over North Carolina. We've had applicants that are right out of graduate school, and then we have some that have come from mandated services that are ready for a change. We've also had people who are coming from the mental health system, too, that have been good matches as Success Coaches.
But the position classification is what, a social worker 3? So you have to meet our county's requirement to be a social worker 3 to be a Success Coach, if that makes sense. Whatever.
Yes, yes. And you were saying earlier the requirements for that was?
Minimum a bachelor's degree and 2 years experience.
Great, okay. Thank you. And the next question is, have the Success Coaches worked with any families who are Native American?
Not to this point. Yeah, not to this point. I don't think in a registered Native American tribe. Oh, well, Portia's just letting it. Portia is in our Native American registered tribe. We didn't realize that. So yes, we have.
Okay, great. Thank you. The next question is, will we be able to gain access to some of the assessment and evaluation tools?
This is Karin. Yes, my contact information, I think, is available as well, correct?
Yes, we'll be sure to
Yep.
put up everybody's contact information at the end.
Yep.
Great. Thanks, Karin.
Mm-hmm.
The next question is, are family team meetings utilized in preparing families for reunification or during the post-reunification service period?
Child and family team meetings should be utilized in preparing a family for reunification. When that happens, we encourage Success Coaches to attend those meetings as families exit care. Now, let me just preface this. That's how we used to do it before the randomized controlled trial. Things are a little different because we're in a randomized controlled trial and we have to engage families a little differently because of that. But without that piece, without the evaluation piece, the Success Coach would be attending that meeting and meeting the family as they are preparing for reunification. So, yes.
Families who are used to having child and family team meetings during the foster care process, we have had some that continue that process, has that support system, as they exit foster care, and they utilize that with the post-care support team, with our Success Coaches.
Great. Thank you. The next question is there a specific time for out-of-home placement before the family is able to participate in the program?
No, they just have to have been reunified from foster care. It can be the same day of.
Okay.
Is that what,
Great.
were you asking how long they have to be in foster care before, or how long they have to have exited?
The question is, is there a specific time that they had to be in out-of-home placement?
Out of it.
Oh, no.
So it sounds like no.
No.
Okay, great. And then the next question is, where does the funding come from for the Success Coach? And I know Phil talked a little bit about that, so I'm not sure if anybody can add anything additional to that.
There is a couple other funding sources. We have been able to utilize TANF funding where they are billed day sheet codes in the past, depending on where that block grant is in North Carolina. The Success Coach program is also run in our post-adoption program, and we utilize a state grant from Post-Adoption Services from North Carolina to run that portion of the Success Coach program. And Casey Family Programs also funds a portion of Success Coach programs, along with Catawba County Social Services.
Great, a lot of funding resources there. The next question is, what other counties are involved besides Catawba County?
For the reunification program, there are 4 other additional counties involved, and that's Caldwell County, Alexander County, Wilkes County, and Burke County. Those same programs, same counties are available for our post-adoption service, which is the same Success Coach model, along with Ashe and Allegheny County.
Okay. The next question is, how often does the coach meet with the family? And then a couple follow-up questions. Why is the coach available 24/7, and what services would be provided after hours?
Yeah. So in the first 60 days of a Success Coach opening the case, they are going to see the family 3 to 4 times so that they're able to thoroughly complete the assessment so they can find the best way we can help the family. From that assessment phase, they are at minimal going to see the family monthly until the service starts to fade out at the end, and then they may see them quarterly. And so the second part of the question, can you repeat the second part of the question?
Sure. Yeah, why is the coach available 24/7? What services would be provided after hours?
Yeah, so typically what is provided is just telephone support. So let me give you a great, for example. We had a family who's actually, their husband was in a hospital that was about an hour away, and he was passing away. So that was one point where the Success Coach actually did work after hours and went and picked up the mother and the children so that they could say goodbye to their father. Other things that have happened on-call crisis is families who are feeling like they may relapse. Success Coaches provide on-call assistance to that to help them use their coping skills and use their relapse prevention plan and remind them of their relapse prevention plan. We've also at times helped families with food assistance after hours when it's been over holidays and they haven't had food. A majority of the on-call telephone is telephone contact, and I will tell you it is actually pretty rare that we get crisis calls. We've been running this program since 2010, and it's probably 15, 20 calls, even in that, of like true crisis. Because otherwise, they're going to the hospital or calling 911 if it's a true medical emergency.
Sure. Thank you.
Yeah, but let me also emphasize, a lot of the work is done after hours because many of our families, like for now, like even Portia's having to take off work to be here with us today. Majority of our families do work, so majority of the Success Coach work is after hours, probably from 4 on, visiting with families.
Okay, great. That's great clarification. Thank you. The next question is, my understanding is that the coaches are not providing therapy. Is this correct?
That's correct. They're really providing a social work service or what we call enhanced case management service. They do a lot of skill building and coaching in the home, like building parenting skills, some coping skills, those sorts of things, but it's not therapy. They do service coordination to link families with the therapy that they may need for the children, the adults in the home, or the family as a whole.
And we made that decision based off of what parents were telling us. When we did our needs assessment initially, parents said they did not want another clinician. They wanted somebody who was going to walk the journey with them, and they had access to clinical services.
Great. Thank you. And then are success coaches employees or contractors?
They are employees.
And follow-up question, how does the retention of success coaches compare with that of general caseworkers?
It depends on what type of caseworker you're talking about. I think the retention rate of success coaches is greater than social workers who work in investigations and assessments. I think it's comparable to workers who work in foster care and adoption units.
We're a pretty small team. I would say on average, most of them have been here 3 years.
The success coaches?
Yes.
Mm-hmm.
Okay. The next question is regarding families with closed cases who may need the service. Can they access the program at this time?
Yes, if a family who is closed with the service, if they call, we can do a 2-week booster session with that family to help them with whatever they're going through at that time. If during that booster sessions we realize that there's really a lot more goals that they need to work in because their family's at a different developmental milestone, we can reopen that case.
Okay, great, thank you. And does your county offer post-adoptive counseling services to families?
Yes, we do. The Success Coach service is offered post-adoption, but we also have adoption competent clinicians in our agency that offer clinical post-adoption services.
Great. And do Success Coaches work with clients to identify, develop, and achieve long and short-term life goals related to plans for, say, battling trauma, substance abuse, reunification, and other issues they may be facing in order to achieve success? And if so, what are they?
Yeah, I think Portia's probably a perfect example. She was battling substance abuse. Our families have a wide range of needs, and they're usually very complex because that's what brought their children into foster care. A majority of our reunified families are battling trauma, and they are battling substance abuse. They're also battling poverty, rejection, lack of stable relationships. They're battling children who have significant mental health problems, stable homes. They're battling domestic violence, partnerships, and even inter-family challenges within their own biological family system. Mm-hmm. It is really, I mean, every family is so unique, and we have actually not seen significant trends in that area of the families that we serve.
Okay. The next question is, is the Success Coaching Program a program that you think can be scaled and replicated in other regions or nationally?
Yes, I think so. We have a manual, we have a replication manual, a training manual. We have those materials that would be needed to help support replication, and I think it's a service that could easily be replicated with the proper supports for implementation.
Great. And I think kind of a related question around rural versus urban areas. So the question is, have you thought about comparing numbers or success from urban areas? You know, are not most of those counties rural?
Most of the counties that we're currently serving in the randomized controlled trial are all pretty rural. We haven't expanded to a more urban area.
Okay, great, thank you. I think we have time for a couple more questions. Are the child welfare agency's cases considered open for the entire period of time the families are in your post-reunification program?
Their mandated child welfare record is closed, and a new record is open in our program, and it's separate. It's not even in the same database system. It is very separate from mandated services. Mm-hmm. And when families open up with our voluntary service, they understand with the consent that the only way their record will be released is if it's court-ordered or they have a report of abuse, neglect, or dependency, just because child protective investigators have rights to that information. But it is a very separate record. And we work hard to try to separate ourselves from mandated services. I think even Portia said in it that A lot of people will reference that we're not even part of DSS. We are a part of DSS, but I think because we work so hard in making sure we have this engagement and genuine relationship, they often forget that we work for Department of Social Services.
Great. That's a really helpful clarification. Thank you. The next question is, what is the average caseload size for a success coach?
12 to 15 cases is the average caseload size.
Okay. And then I think there's one final question. How much trauma-informed training did the coaches obtain?
We use the Child Welfare Trauma Toolkit that's through the National Childhood Traumatic Stress Network, which is a 2-day training, has their trauma-informed training. In that, there's a trauma assessment tool for children that they're trained in. Internally, we have a licensed clinician who also provides consultation to our team, which also helps them think through the various complex trauma that our families are challenged with. So they have consultation regularly with outside clinicians who also helped us develop a tool for adults so that we can help assess the impact of trauma on adults.
Wow, great. This is all such great information and obviously so many questions from our audience and so much interest. So, again, thank you, Chrissy and Heather and Phil and Karin, and especially you, Portia, for sharing your story. We really appreciate your presentation. So at this time, we're going to just wrap up and make sure to give you guys that contact information. So next slide, please. As you can see up on the screen are all of our names and email addresses. So myself, Jennifer Marcelli, jennifer.marcelli@icfi.com, taffy.compain@acf.hhs.gov, and then for Chrissy, it's c.triplett@catawbacountync.gov. Heather's is hball@catawbacountync.gov. And then Phillip Redmond Jr., Redmond@tde.org, and Karin Malm, KMALM@childtrends.org. So thank you all again very much for participating in today's webinar. You can find additional information on the Center for States at capacity.childwelfare.gov. And again, please go visit the National Foster Care Month website, and you can access that through the Child Welfare Information Gateway. So I just want to say one more time, again, thank you to all of our presenters, and thank you to all of our attendees. We really appreciate you coming on today and asking such great questions. Thank you, everybody.
Ladies and gentlemen, this concludes today's discussion. We appreciate your participation.